Welcome to Learn and Teach American English with Maestro Sersea Podcast. Our educational podcast is designed for adult learners who are new to the United States. It covers numerous essential topics, real situations you will encounter in daily American life. Each episode is organized into 3 sections. Section 1, Key Vocabulary. 10 important words and phrases related to the topic, each with a clear definition and an example sentence showing how it is used in context. Section 2, Dialogue. A realistic conversation between 2 or more people in a real-life situation. Pay attention to the phrases used and the polite, direct communication style common in the United States. Section 3, Article. An informational article that gives you deeper knowledge about the topic. After listening, try to summarize the main ideas in your own words. Suggested study approach for best results. Study 1 episode per session. First, review the vocabulary. Second, listen to the dialogue. Third, listen to the article. Then, review the episode 1 more time to reinforce what you have learned. This podcast covers transportation, finance, health, education, employment, daily life, housing, safety, community resources, civic life, and a variety of other helpful topics, the areas of American life where strong English skills matter most. Okay, are you ready to begin? Let's get started.
At the emergency room. Describing symptoms, understanding triage, dealing with medical bills. Section 1, Key Vocabulary. Study these 10 words and phrases. They will help you in this situation. 1. Triage. The process of evaluating patients to decide who needs care first based on how serious their condition is. Example. At triage, the nurse asked me to rate my pain from 1 to 10. 2. Copay. A fixed amount of money you pay for a medical visit, even if you have insurance. Example. My insurance has a $50 copay for emergency room visits. 3. Prescription. A written order from a doctor that allows you to buy specific medicine from a pharmacy. Example. The doctor gave me a prescription for antibiotics, which I picked up at the pharmacy. 4. Vital signs. Basic measurements of your body's functions, including temperature, blood pressure, pulse, and breathing rate. Example. The nurse checked my vital signs. My blood pressure was a little high. 5. Allergic reaction. A harmful response by your body to a food, medicine, or other substance. Example. She had an allergic reaction to penicillin. Her face swelled up and she had trouble breathing. 6. Discharge. When a hospital officially releases a patient to go home. Example: after 6 hours of tests, the doctor discharged me with instructions to rest and stay hydrated. 7. Follow-up: a medical appointment scheduled after a first visit to check on your recovery. Example: the doctor told me to schedule a follow-up appointment with my regular doctor in 1 week. 8. Symptom: a physical feeling or change in your body that may indicate illness or injury. Example: my symptoms included a high fever, body aches, and a sore throat. 9. IV, intravenous: a tube inserted into a vein to deliver fluids or medicine directly into the blood. Example: the nurse put in an IV so the doctor could give me fluids quickly. 10. Medical bill: a document from a hospital or clinic showing how much you owe for medical services. Example: I received a medical bill in the mail 2 weeks after my emergency room visit. Section 2. Dialogue at the emergency room. Nurse: hi there. What brings you in today? Anna: I have been having severe stomach pain for the past 4 hours. It started on the right side and keeps getting worse. Nurse: I see. On a scale of 1 to 10, with 10 being the worst pain you've ever felt, how would you rate it right now? Anna: about a 7. It feels sharp, and it hurts more when I walk. Nurse: have you had any nausea or vomiting? Anna: yes, I vomited once about 2 hours ago. I also have a low fever. Nurse: are you allergic to any medications? Anna: yes, I am allergic to penicillin. It causes a rash. Nurse: good to know. Thank you. I'll put that in your chart. Do you have insurance? Anna: yes, I have Medicaid. Here is my card. Nurse: perfect. I'm going to take your vital signs now: temperature, blood pressure, and pulse. Then a doctor will see you soon. Anna: how long is the wait, approximately? Nurse: given your symptoms, you will be seen fairly quickly. We want to rule out appendicitis. Anna: what does that mean, rule out? Nurse: it means we want to make sure your appendix is not the problem. We'll do some blood tests and possibly a scan. Section 3. Article: how the emergency room works. The emergency room, or ER, is where you go for serious medical situations that cannot wait for a regular doctor's appointment. Knowing how the ER works will help you feel calmer and communicate better when you need care. When you arrive at the emergency room, you will first speak with a triage nurse. This person's job is to evaluate how serious your condition is. Patients with life-threatening conditions, such as a heart attack, difficulty breathing, or severe bleeding are seen first. Others may wait longer depending on their symptoms. When you speak with the triage nurse or doctor, it is important to describe your symptoms clearly. Say exactly where the pain is, when it started, how intense it is, and if anything makes it better or worse. Mention all medications you are taking and any drug allergies you have. After triage, you will be taken to an exam room. A nurse will check your vital signs, including your temperature, blood pressure, heart rate, and oxygen level. A doctor will then examine you and may order tests such as blood work, a urine test, or an imaging scan. If you have health insurance, bring your insurance card to the ER. If you do not have insurance, tell the billing staff. Many hospitals have programs to help people with limited income. You have the right to receive emergency care regardless of your ability to pay. After your treatment is complete, the doctor will discharge you. You will receive written instructions telling you what to do at home, what medications to take, and when to schedule a follow-up appointment. Read these instructions carefully before you leave.
Thank you so much for listening to the Learn and Teach American English with Maestro Sersea podcast. Today's episode is designed to help adult English learners communicate with confidence in real American situations. Here's what I'd like you to do before our next episode. Review today's vocabulary, practice the dialogue out loud, and listen again to the article, maybe even take notes. And if you found this helpful, please subscribe to our podcast and share it with a friend or colleague. Your support helps us reach more learners around the world. Until next time, stay curious and keep learning.